The thymus is a gland that lies right in front of the heart and behind the breastbone. It is part of the immune system. In some patients where they are immune compromised or they have autoimmune disease, the thymus becomes enlarged in either an attempt to overcome recurrent infections or in itself causing the disease process by attacking parts of the body, commonest being the muscles, with the disease known as myasthenia gravis.
Before I just get tired, my bones, my whole body starts to ache, and I just didn't think of it like, I'll end up in hospital. That's how it starts with the symptoms. I was ill in hospital. They did a X-ray, they did a CT scan, and that's when they told me that I've got a thymus, a growth on my chest. And then I was referred to New Cross, to Dr. Habib.
In all these cases, we need to remove the thymus gland. Traditionally, this was removed by a full-blown cracking of the center of the chest to approach the thymus and remove it appropriately from on top of the heart. Nowadays, we can do this by 3 keyholes from the side, 2 under the breast, and 1 in the armpit, going in between the ribs and peeling it off the heart and the great vessels and removing it in a bag through the armpit. Patients usually recover within a day or 2 and go home after that. In place of that, this conventional sternotomy required the patients to stay in hospital for a week and recover at home for approximately 3 months while the bone is healing. On the other side, with the keyholes, the patients usually go back to normal quality of life within a week of the operation.
Mr. Habib is one of the best surgeons, that ever came into my life. Bless him. The surgery was very smooth. When I went to his clinic, it was really smooth as well. The surgery, aftercare was brilliant. I couldn't fault that. The nurses were so brilliant. They looked after you and they made you really, part of that family in the hospital. So I think you couldn't ask for anything better. So.